I see those old Chinese cups, like they have fire, and
Yeah.
is that the same? Similar? I had cupping like 2 weeks ago. My massage therapist started putting those cups.
Yeah.
So I took off my shirt and Sherry saw all the, my wife saw all the cups. So where did you do that? I got caught. The evidence was there because
Yeah.
you have those, crop circles in your body.
When the scar tissue forms, it's not nice, elastic tissue like our normal healthy tissue is. And over time, if you don't break that up, it can actually become.
Hi everyone, welcome to our Ask My Physical Therapist segment. And I'm here again with Dr. Jenny Winters. She's a licensed physical therapist. So we're gonna learn today about cupping. So Dr. Jenny, how does cupping work? How does cupping therapy work?
Cupping is a kind of soft tissue mobilization technique. So a lot of the techniques that most people go to are like massage or the scraping. You're kind of pushing down, digging down into the tissues. The goal of cupping is exactly the same, to try to break up any adhesion, scar tissue, increase blood flow, but it actually does it in the complete opposite way. So rather than digging down, putting pressure into the tissue, it's suction and creating space between the layers of the tissue.
So it's more pulling it out.
Yes. Yep. So kind of pulling, lifting, separating all those layers of tissue.
I see those old Chinese cups, like they have fire, and
Yeah.
is that the same? Similar?
Yeah, it's the same. They just made it easier so we don't have to use the fire. But we're just using air or suction now. But yeah, it's the same techniques that they do use with the glass cups and the fire.
Okay. So basically, they're burning the oxygen inside the.
Yep, to create the suction.
I see. Okay. Like whoa, it's like magic. So, what conditions or symptoms can cupping help treat? What's your normal patient that they have cupping?
I think cupping is great for scar tissue, especially knee surgeries, knee replacement. Once the incision is totally healed, cupping is a great way to break up any scar tissue in there, even after ACL, meniscus, even those tiny just scope pokes in the knee can cause issues. So after surgeries, always I'll use cupping on people. After rotator cuff surgery too, after it's healed, all the small incisions, they get bound down, and that can be painful and restrict movement. So those patients always, some people like it as like kind of a flush. So if I have athletes getting ready for a race or just a big weekend, they like using the cupping with the gliding, just to get all the fluid moving and out of there, break up any restrictions within the tissue, the fascial layers. Or if people just haven't responded to massage, if they go get routine massages, their upper trap's not releasing, their back's still tight, cupping is a great other option, and some people just respond better to the suction versus the compression.
So, like, how should one prepare for a cupping session? Are you clothed? Are you.
For best results, it's easier if you do wear loose clothing so that we can expose the full area. Because a lot of times the painful area is not the only spot that we kind of need to work on. So just wearing loose clothing so that we can adjust if we need to get to the area. And then we'll use like a lotion or something to that area and apply the cups, kind of move them around a little bit. Sometimes too, we'll put the cups on and do a little bit of movement if we need to be a little bit more aggressive.
You mentioned about people who had knee replacement or surgery. Can you explain more about how those scar tissue evolve in the tissue?
Yeah, so a lot of times after a knee replacement, it's a pretty big incision, and people are hesitant to kind of push on it, work on it. But cupping can even help just flatten it, soften it. When the scar tissue forms, it's not nice, elastic tissue like our normal healthy tissue is. And over time, if you don't break that up, it can actually become innervated and be painful. So the sooner you can break it up, or like realign the fibers, because a lot of times scar tissue will just start laying down in all different ways. But ideally, we want our tissues all to be nice and parallel so that when we need it to stretch, it glides smoothly. So yeah, the goal is to break up that scar tissue as quick as possible once the incision is fully healed.
Is cupping painful or uncomfortable?
It's generally not too bad. The first visit, I would say, the first time you ever have cupping to an area is usually the most kind of uncomfortable, especially with the gliding. We, over time, just develop little micro adhesions between our skin, the fascia, all those layers, and one swipe over an area breaks those up. But that can be kind of uncomfortable for a big area. So once you break up that, usually it's not. And then every session after is usually significantly less uncomfortable. Even in like the problem areas, you'll see less bruising usually as the area kind of normalizes.
I had cupping like 2 weeks ago. My massage therapist started putting those cups.
Yeah.
So I took off my shirt and Sherry saw all the, my wife saw all the cups. So where did you do that? I got caught. The evidence was there because you have those, crop circles in your body.
Yeah.
So how long does the cupping marks last, and are they harmful?
They are not harmful. So there's kind of different techniques to the cupping. But an interesting thing, so generally the first time I'm working with a patient or a client, if we're working their shoulder, I will put a bunch of cups covering their back and their scapula, kind of all at the same time. And how quickly the skin responds actually kind of tells you the problem areas. So once you start to see that the skin's turning that purpley color, you can take the cup off and move them around so that you don't get the really dark circles. They're not something to worry about if you do get the circle, but they can linger. Like if I see patients back a week later, generally I can still see where the cups were. But then each session after that, it's usually significantly less unless we move to a new area, problem area. But ideally, you shouldn't leave every visit with the really dark circles on every time, because you don't need to leave it on that long. We just want to see where the problem spots are.
Thank you so much, Jenny, for teaching us about cupping. So it helps us. Hopefully, we've learned a lot about cupping. And if you want to make an appointment, Jenny is here at Summit Fitness in Scottsdale, Arizona, Mondays and Fridays. If you want to make an appointment to take out those adhesions or scar tissues, if you just came back from surgery, it's a great way to heal your tissue. So thank you so much for joining, and bye.